Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In today's video, we're going to talk all about elimination disorders. Broadly speaking, that is learning to urinate and defecate properly and what happens when it goes awry. So if you like the content of this video, hit the like button, subscribe, click the notifications tab, and that will make you have access to all my videos and know when something new comes out. So without further ado, here we go. So elimination disorders are when a child repeatedly either urinates or defecates in their clothing, in their bed, or on the floor. In order to have an elimination disorder, the child must have already met the age or reach the age where we expect them to have gained control over these bodily functions, and these deficits cannot be explained by some other physical illness. What we know is that elimination disorders typically can turn into distressing and chronic difficulties, such as not being able to properly participate in social activities, and it can create some embarrassment in the classroom and so forth. So the two broad categories of elimination problems are enuresis and encopresis. So typically speaking, though, most children outgrow these elimination disorders even without treatment in the vast majority of cases. So what is enuresis? Enuresis is a repeated involuntary, but it can sometimes be voluntary or intentional, bedwetting or wetting oneself or one's clothes. When we talk about enuresis, there are three subtypes. There's nocturnal, diurnal, and combined. Nocturnal enuresis is the most common. That's when a person wets the bed only during their sleep at night, whereas diurnal is when they urinate during waking hours. This is more common among females relative to males and is typically associated with some kind of social anxiety or stressful event at school. But you can have both nocturnal and diurnal, and we talk about that as being a combination of the two, or combined type. In order to have enuresis, a child must be at least 5 years old to receive this diagnosis. And it's important to note that that is when we believe that a child will learn to control their urine. And I know you might hear people give you different times when a child should start potty training, 18 months, 2 years, whatever. But we expect it to be mastered roughly by the age of 5. And as I said, these issues of enuresis typically resolve themselves without treatment. So what's the frequency? The frequency of nocturnal enuresis is anywhere between 4 to 13% of children under the age of 10. But by the age of 10, it only affects about 3% of males and 2% of females. And then by late adolescence, it's usually roughly 1% or less. Now, that's nocturnal enuresis. Diurnal enuresis affects only 3% of 6-year-olds. So you could see, when I said nocturnal enuresis is far more common, you see what I mean, 4 to 13% versus 3%, even at a younger age. And both forms of enuresis, nocturnal or diurnal, are far more common amongst lower education, lower socioeconomic status, and institutionalized children. So that's enuresis. Now, check this out. When we talk about encopresis, right, so it's less understood. It's oftentimes involuntary. It seldom occurs during the sleep, and we start the diagnosis at the age of 4. Now, that's interesting because when we said enuresis, we said it would be at the age of 5. So you might say, well, people typically potty train first, they teach urination, then defecation, right? So why is encopresis, why does it have an earlier diagnosis point? The answer is the sensation for defecation is much stronger. So you're able to detect the signal of having to go to the bathroom typically earlier. So if we're talking about a disorder, the sensation for defecation is stronger than urination. Now, this condition is more common among boys relative to girls. And we have two subtypes when we talk about encopresis, with or without constipation and overflow incontinence. So constipation and overflow incontinence is the sense where a child does not void or defecate everything that they have to go. So it binds up and it leaks out throughout the day or whatnot. So if it occurs with constipation or overflow incontinence, we know how to treat it to help have regular bowel movements and fully void. Without constipation, overflow incontinence, it's a little bit harder to treat. Now, when we talk about encopresis, it's about 1% of 5-year-olds, which is more common amongst boys, as I said. And we have primary and secondary encopresis. Primary encopresis is a child that's reached the age of 4 without establishing fecal continence, so they never mastered going to the bathroom or eliminating their bowels. Whereas secondary encopresis is where they previously mastered potty training, but now they've kind of regressed, right? So those are the specifiers. And that is a very quick understanding of what is enuresis and what is encopresis. I hope this helps you. Take care, everybody. Till next time.